So the real risk with not developing business acumen in your clinical leadership really is maintenance of the status quo. And with the way our healthcare industry is changing and evolving, and patients are expecting more affordability, more products, more services at a better price, the status quo simply cannot be maintained over time. So the only way that that's going to change is if you develop people who are able to see a problem and then solve it. They've been developed and trained with a completely different skill set. They can see and solve problems related to quality, safety, all of those kind of things really well. But how do you see a problem in your cost structure? How do you see a problem in how you're utilizing your assets? How do you see a problem in delays in your working capital and your cash receipt structure if you don't even know where to look? So developing and augmenting the existing skill set of your leaders with business and financial acumen gives them a whole new set of problems that they're now able to see. It's the ability to think big and the ability to see and solve completely new sets of problems that we're not currently even solving in healthcare. And it's those organizations who are going to be able to give that to their people and empower them to do that are going to win in the future, because the market is demanding it. In terms of which of the 5 drivers is not well understood within the healthcare provider space, I would say the top one is assets. Now, assets as a concept is a little bit abstract. It's those things that we own and control that have value. That's an asset. And healthcare is really asset heavy compared to other sectors of the economy. So some examples for that are the Mayo Clinic recently made an increase in investment in a cancer therapy that requires a proton beam. So, we're thinking about particle physics technology that's really expensive being used in a therapeutic way. And that's only the tip of the iceberg, right? You have all kinds of imaging assets, MRI machines, CAT scans, all your X-ray, mammography, technology, all of those things. And what people don't understand is that those assets are being paid for, especially in the not-for-profit space, those assets are being paid for with community dollars. The community is the one that is funding the whole operation. Not-for-profit organization gets tax breaks from the government. So how a healthcare organization allocates the community's dollars to the benefit of the community is a really tough thing to think about. CFOs think about it really well. The finance people have a really good grasp of this. But it's not the finance people who are bringing the request to the table for how to spend the community dollars on one asset or another. It's clinical and other leadership that are trying to make that case. So how do you make the case, and how do you understand how to best spend those dollars? Well, it's not an easy thing to figure out, especially if you don't have a business and financial background. But if you start to understand how the big picture all fits together, you can become a wiser steward of the community's dollars. You can understand, how many years, for example, the payback period should be on a particular asset. You'll be able to understand that, an MRI machine doesn't break even until 2 o'clock in the afternoon, right? Things like that will help you make better, smarter decisions. How do you staff that machine? When do you open? How many days are you open? What are the hours? Those seem like all pretty obvious things to think about, but without having a good understanding of business and financial acumen, you might not even know to ask those questions. And again, like we've been talking about, this is no fault on the people who are leading it. They're used to asking a completely different set of questions. And those are the right questions for them to ask. Now, how do you add in the business side of things on top of that solid foundation of caring, ingenuity, safety, quality, all of those things? That's what's going to unlock your organization and achieve another level of performance.